Provide privacy for the deceased. Place body in a supine position with the head slightly elevated and arms on side. Put on gloves to protect yourself from body secretion. Close the patient's eyes by gently pulling the eyelids over the eyes. Use a rolled up towel under the chin to close the patient's mouth. Remove the patient's watch or other jewelry and surrender all valuables to the relatives and have them sign out. Remove indwelling devices if appropriate per the organization. Wash the soiled area of the body. If family members are assisting with washing the body and providing post-mortem care, instruct them to don gowns and gloves for protection from body fluids. Spread the towel under the patient's head. Make a mitt of the washcloth using the triangular or rectangular method. Wash the face. Start washing the client's eyes from the inner canthus to the outer canthus. Wash the client's face, ears, and neck. Rinse and pat dry. Spread towel under forearms and wash. Distal to proximal including axilla, using firm strokes. Rinse and dry. Repeat the procedure on the other arm near you. Don't forget to change the water. Spread the towel over the patient's chest and wash chest to waist using long, firm strokes. Wash, rinse, and dry. spread the towel under the far leg and wash using long, firm strokes. Rinse and dry. Repeat the procedure on the leg near you. Wash both feet and change the water. Turn the patient on his or her side and place the towel alongside the back. Wash the back and buttocks with long, firm strokes. Rinse and pat dry. Change the water. Place absorbent pads under the patient's buttocks. Replace soiled linens and gown with clean articles. Put soiled linens and pads in an isolation bag and remove them from the room. Place a clean sheet over the patient's body up to the chin with the arm outside the covers, if desirable. After the body has been viewed by the family member, attach an identification tag to the body. Leave wrist identification in place. Wrap the body as described for a particular institution. Turn the body away from you or into the opposite side to give us space where we can insert the sheet under the patient. Return back the patient into supine position. Raise the side rails up and go to the other side of the working area. Spread the rolled portion of the sheet. Cover from the bottom or feet to the body and lastly to the head. You can use safety pins to secure the sheet. Fold the new sheet covering the entire body of the patient, and while covering, slowly remove the top sheet without exposing the patient's body. When done, ensure that prompt transportation of the patient's body to the mortuary has been arranged. If a delay is anticipated in the transfer to mortuary care, transport the patient's body to the morgue. Dispose equipment, supplies, and garbage properly. Remove and discard PPE. Perform hand hygiene and document the post-mortem procedure implemented. Place the identification tag into the chest. For the evaluation, assess body care done and ensure the body is transported properly with an identification tag. Documentation. Document the time of death and the physician who certifies the death. Record if there are any resuscitative measures done. Document if there is any special preparation of the body for autopsy or organ donation.